Hi, I'm Greg Cummings, pharmacist and host of Pharmacy Pearls. In this video, I'll be discussing alcohol and medications, when it's okay to have a celebratory drink, and when alcohol should be avoided like the plague. Cheers. First of all, it is important to understand that alcohol is a central nervous system or CNS depressant, meaning that it can slow brain activity. This is also true for classes of medications like opioids, benzodiazepines, or barbiturates, just to name a few. In combination, this could lead to a decreased rate of breathing, reduced heart rate, and loss of consciousness, possibly leading to coma or death. For this reason, alcohol should be avoided entirely when taking CNS depressant medications. On the other hand, antibiotics plus alcohol usually aren't a problem. With that being said, there is a significant exception. When taking the antibiotic metronidazole, alcohol should be completely avoided during treatment and for 3 days after. In this case, alcohol consumption could result in what's called a disulfiram type reaction, consisting of substantial hangover symptoms including flushing, throbbing headache, nausea, and even projectile vomiting. You should also be careful with extended release medications, as alcohol can sometimes increase the rate of drug absorption or interfere with medication release, possibly resulting in a dose dumping effect. For example, you should never use alcohol with Nucynta extended release or Cadian due to the risk of overdose. It's okay to have the occasional drink with acetaminophen or NSAIDs, but they should be avoided if you have 3 or more drinks per day, because of a higher risk of bleeding with NSAIDs and liver toxicity with acetaminophen. An occasional drink is also usually okay for those taking antithrombotic medications like warfarin, Pradaxa, or clopidogrel, but keep in mind that alcohol can increase your risk of falling, which is never good where bleeding is concerned. Additionally, alcohol intake can increase the INR in warfarin patients when done acutely, while chronic drinking can slightly lower the INR. And, when combined with alcohol, varenicline or Champix, a smoking cessation aid, may increase intoxication, aggressive behavior, and amnesia, so be careful until you know how this combination affects you. Finally, alcohol consumption should always follow Canada's low-risk alcohol drinking guidelines. Specifically, this means no more than 10 drinks a week for women, with no more than 2 drinks a day most days, and 15 drinks a week for men, with no more than 3 drinks a day most days. Thank you so much for watching. Check out the description below for some additional resources. And if you enjoyed this video, please show your support for Pharmacy Pearls by subscribing to my YouTube channel. Take care.